America's favorite drug can be found on nearly every street corner across the country. The FDA estimates that 80% of U.S. adults consume caffeine every day. The morning coffee run or afternoon pick-me-up can get us through the workday, but this liquid energy may be affecting more than just your mind. Caffeine is a diuretic, meaning that it increases the urgency and frequency of urination. When consumed excessively, it can contribute to an overactive bladder, a condition that plagues over 30 million Americans.
You can view overactive bladder as having like a spastic bladder. So if the muscle of the bladder is involuntarily squeezing, that's why someone can experience a lot of frequency and urgency. And like any muscle spasm, like if you have a spasm in your calf muscle, right? There's nothing you can do about it. You just have to let that thing play out. Same thing with your bladder. Once it involuntarily spasms, the urine starts to come out and you don't really have a lot of time to get to the restroom.
That's Dr. Karen Eilber, a professor of urology and associate professor of obstetrics and gynecology at Cedars-Sinai Medical Center. She says the treatment protocol for an overactive bladder has 3 levels. The first step includes taking a look at daily caffeine intake.
If someone's drinking 6 Cokes a day, they probably need to cut back to maybe just having 1 or 2. And then also timed urination. So if someone can easily go 2 hours without having urgency, they can just preemptively go to the bathroom every 2 hours.
Eilber says you don't have to completely cut out your favorite beverages, just have everything in moderation, even water.
If you're drinking 2 gallons of water a day, it doesn't matter what treatment I give, I can't help you. You have to actually cut your fluid back. And in fact, there's no scientific basis behind drinking 8 glasses of water a day. When your fluid requirement really depends on size of the person, what type of environment they're in, like in a drier area versus one that's more humid, if you exercise a lot. So your fluid requirement varies. And in general, if you're thirsty, drink. If not, you probably don't need the fluid.
The second line of treatment is medication. Eilber says these pills are equivalent to bladder muscle relaxants, which help reduce spasms. However, if a patient can't tolerate the side effects like dry mouth and constipation, the third treatment option is Botox. Though most commonly known for its cosmetic uses, Botox is essentially a paralytic. Bladder Botox prevents the spasms that cause overactive bladder symptoms.
So Botox is injected through a cystoscope or a camera that is used to enter the urethra or the tube where the urine comes through into the bladder itself, and then using a special little tiny needle that goes through the cystoscope, the Botox is injected into different places of the bladder muscle.
While the entire procedure only takes a few minutes to complete, Eilber says it's not totally painless.
You can imagine that putting a camera where your urine comes through probably doesn't feel too good. So yes, we actually will give people local anesthetic, which is not an injection. It's actually a topical anesthetic gel that we put inside the urethra to help coat the urethra and the bladder itself to make it less painful. And most people feel a little bit, but the numbing medicine really takes the edge off. And the needle is even tinier than when you have your blood drawn through. So I would imagine it's probably like having like a little, maybe like a little bug bite throughout your bladder, several times. But most people, are talking to me the whole time the procedure is being done. So it can't be too bad.
On average, the Botox lasts about 5 to 6 months, and most people return for another dose. Eilber says some of her patients have been getting the bladder Botox treatment for over 10 years.
There's no real long-term risk per se, except that as people age, I think their disease tends to progress. So one, if you want to call it a risk, is that you have to keep using higher and higher doses of Botox to get the same outcome.
But her longtime patients are happy with their results. There are short-term risks, but Eilber says they're pretty minimal. The chance of infection is low since patients are typically given a preventative antibiotic at the time of the procedure. The other risk is potential bleeding, but the camera that's inserted through the urethra is so magnified that Eilber is able to see and avoid tiny blood vessels.
The real specific risks are people need to understand that Botox is not permanent. So just like whether it's used cosmetically or for migraines, it has to be repeated. On average, people get a response for about 5 to 6 months. I have some people that must metabolize the Botox very slow. They can go 8 months, 9 months, 10 months. I have people who only last 3 or 4 months, but on average, it lasts 5 or 6 months. The other specific risk is there is a risk of inability to urinate. So if the Botox works too well, someone may have to use a catheter or a tube to drain their bladder for a temporary period of time until the peak effect of the Botox wears off.
And Eilber says that should only last a couple of weeks. Though bladder Botox may be new to you, it's not a novel treatment. In fact, the same Botox that prevents wrinkles was originally intended to help manage certain medical conditions.
One of the first uses for Botox was for a condition called hyperhidrosis or excessive sweating. So people would have it injected, I think, into both their armpits and the palms of their hands. Botox is also used for migraines. It's used for other spastic muscle disorders. So there are certain conditions, people who have neurologic diseases where their muscles are really, really tight. So you can inject Botox into the muscle to help relax it so they don't have such spasticity. And then, of course, I think most people are familiar with the cosmetic uses of Botox.
When used to treat a medical condition like overactive bladder, many insurance companies cover the cost of Botox. You can find more information about bladder Botox, Dr. Karen Eilber, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, search Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
Everyone has a right to a family, but no one has the fundamental right to a biological family.
The ethical implications of commercial surrogacy.
Then why breastfeeding isn't a simple answer to the formula shortage.
When people just say, well, just breastfeed. Well, if you aren't breastfeeding, you can't just start breastfeeding.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
My cucumbers that I grew this year, I sliced the first one and I was so proud, and they were not that big, but they were so tasty.
Think gardening's not for you? Think again. Then
I'm seeing a lot of crowds in Europe, and it's not even peak season yet. I mean, people are traveling with a vengeance.
The excitement of heading abroad once again. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more, and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.